Okay, so today we're going to talk about something that's a little bit complicated. It's Anaplastic Large Cell Lymphoma, or ALCL. 10 years ago, ALCL was something we didn't know much or anything about. And now we've learned some things. We study it closely. Plastic surgeons are paying close attention to that. But the information that gets out into the world usually lags behind. So I'm going to give you what I understand to be the most up-to-date information about ALCL. First of all, it is a very uncommon thing. The type of lymphoma that we're talking about associated with breast implants is in the low to mid hundreds of cases in the United States that we know of to this point. There are about 300,000+ people a year that have breast augmentation in the United States. The risk is exceptionally low, but it's not zero, and so it's an important thing that we have to talk about. It does seem to be related to textured implants and not smooth implants. That seems like a very black and white thing. Textured implants has a risk, smooth implants does not have a risk. But like most things in the world, there's some gray. There's different kinds of textures. There's one implant company whose texture is pretty rough. It doesn't feel rough necessarily, but if you look at it under a microscope, there's big peaks and valleys. There's another implant company whose texturing is very soft, and if you look at it under a microscope, it's very subtle. And how your body interacts with those two different kinds of texturing is important and different. If your body sees the rough texture, it desires to grow into it and sort of make the implant and the breast one thing. If it sees the very soft texturing, it doesn't interact with it at the same level. It does seem like the coarser or the more dramatic textures are related to ALCL at a higher level than the soft or the more subtle textures. In other words, texturing and its relationship to ALCL seems to be on a spectrum, where on one side of the spectrum there's a very, 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 very uncommon relationship. And on the other side of the spectrum there's a very, very uncommon relationship between the two things, but they're different. Why would we use textured implants then if we know that there's risk, that there's no relationship with these risks in a smooth implant, but there is in a textured implant? Well, the reason is they can be really helpful. They can help decrease the likelihood of a revision down the line. In other words, they can decrease the likelihood that a person needs another surgery down the line. And everything in this conversation about breast augmentation has a give and take to it. So with the textured implants, we may say there's a very low risk of this ALCL thing, but if we don't use the implants, there's a fairly higher or slightly higher risk of you having to have a revision down the line. And then you and your plastic surgeon would have a very nuanced conversation about which of those risks is more significant for you. For some people, the risk of more surgery is greater. For some people, the risk of this uncommon but potentially important thing is more common or more important. So ALCL isn't black and white. We know more about it now than we've ever known before, but 3, 4, 5 years from now, we'll know additional stuff. So stay in touch, stay in tune. If you have questions about this, feel free to reach out to us or your plastic surgeon or someone else in the field that you like and trust, and let us know if we can help.